Have you ever been outside when it's really cold, you've been out there for a long time, and then your hands turn blue, or let's say your fingers turn blue. You go back inside, you sit by a heater or something, your hands warm up, and then you get this tingling feeling, and sometimes it's kind of painful. Well, imagine something like that, except occurring on a daily basis, and and that can be more severe and can last for a longer period of time. Well, this is what's known as Raynaud's phenomenon, or more commonly as Raynaud's syndrome. The disease itself is not very well known in this world, but and but my purpose here today is actually to tell you some of the history, the side effects, and the ways that people stave off Raynaud's attacks with different methods. Well, a long time ago, a man by the name of Maurice Raynaud discovered this strange disease when a patient came into his clinic. What had happened was this woman had her hands turn cold. They were really numb, and then after a while, it actually didn't improve. And when she came into his office, the fingertips of her hands were all black. Well, what he had found out was that because her hands had become so cold, there was a less amount of oxygen actually reaching them, that they became a bit lifeless, and gangrene had actually accumulated on her fingertips. And he saw this happen with many other patients as well, where when they were exposed to a cold environment, their hands changed different colors, from white to blue, and then eventually back to red if it improved. Well, later on he actually found out that what was happening was actually called vasospasm, where there's an overreaction in the nerves and the skin which causes the blood vessels to thin, which restricts blood flow to the extremities or to the areas affected. This is a overreactive response to maintain the core body temperature in the affected areas, which is pretty much the reason why the affected areas turn the different colors that they do. Now, as time goes on, Raynaud's syndrome was actually classified into two different types. One is primary Raynaud's, which is the least severe, and it's the one that I have, where it doesn't actually occur with anything else. It happens by itself, and at any moment when there's a cold environment involved. Well, according to Cedars-Sinai and other scientific bodies, the second one, the secondary Raynaud's syndrome, is a much more severe form and can cause the health problems that people have when they have Raynaud's, such as, let's see, somebody who's had an attack that's lasted for a few hours, it hasn't gone away, and their hands are starting to become, well, they would say it would be frostbitten, but it's a bit numb, and if it's not treated soon enough, gangrene will develop at the tips of the fingers. And this is all according to a pattern which MedTV talks about, where as the attack progresses, your fingers change colors from the white to the blue to the red, and then back to normal. Well, in my Raynaud's, I just go pretty much straight to blue. I've never actually, well, actually maybe, but for most time, I go to blue and then to red. And red doesn't feel too bad. It tingles, it feels nice. Unless one time when I was outside for an extended period of time, my hands become really cold. When I put them under hot water, instead of feeling searing pain, I was feeling a soothing coolness. It is something that I've tried to avoid from now on, in which I take measures to, such as always wearing a jacket, even to class, or even at home, because the air conditioner can trigger an attack. The cold air in the school buildings can cause an attack. Anywhere that you can come in contact with cold air, you can have an attack. Or sometimes even stress and different health-related problems can cause it. And then the several things that people do to actually treat Raynaud's syndrome is to actually there are some medications for it, but according to yourbodycanheal.com, it's much better to do it naturally, because those pills that you'd be taking for it aren't exactly safe. There are many side effects to them when you can do it naturally, and you can even just wear a coat or don't go anywhere where it's cold. Avoid picking up cold beverages with your hands or holding it for just a long period of time. Kind of like common sense stuff to keep yourself warm and out of the cold. And then there's another place called furheals.com, and that's actually a clothing store that specializes in clothing that boosts circulation, such as when I went on there, I saw these really nice inflared thermal gloves, which help boost circulation to the hands, and it was actually made specifically for Raynaud's and people with arthritis and different stuff to help them sleep through the night and keep their hands warm and whatnot. These different treatments were especially something that I would suggest for myself and other people who are suffering from Raynaud's syndrome. And then lastly, as I've told you, the history of Raynaud's it's pretty simple history. It's just that not very many scientists actually know a lot about it. It's thought to be hereditary, but they aren't sure. And then the side effects themselves actually are pretty bad as time goes on and nothing is done to stop the attack. And then later, it's better to treat it, to prevent it. The best thing to do is to prevent Raynaud's from happening in the first place. If you can prevent Raynaud's, you won't have to suffer the attacks as much. But unlike other people who don't have it, Raynaud's is something that is lifelong. It will occur no matter when, no matter what. It is just a matter of when and where it will happen, and how long it will happen. This is Nathan Jared, and this was my informative speech on Raynaud's syndrome. And for my visual aid, I had here an ice cube to cool my hands on, or cool my fingers, to show you what the discoloration that happens. Although for me, if I try to do it intentionally, it takes a few minutes, or even a while actually. It takes continuous amounts of cold air and whatnot to actually turn them, or even drinking a shake can turn my fingers. It's not real good, but you probably can't see it. Yeah, you probably can't see it, but my fingers are usually a bit discolored from other people's fingernails that I've noticed. Have a good day.